इंडिया में चाइल्ड बर्थ तो एक बहुत ही इंपॉर्टेंट चीज है
जी।
देयर आर पीपल हु आर नॉट एबल टू कंसीव व्हाट शुड पीपल डू टू हैव अ हेल्दी प्रेगनेंसी एंड अ हेल्दी चाइल्ड बर्थ और आपने तीन चीजें बोली व्हिच पीपल शुड बी केयरफुल अबाउट
You know, it does lead to a lot of depression. I feel men are very becoming, helpful, and they're changing their attitude, which is
Right.
fantastic.
Right.
But still,
You mentioned about smoking, drinking. How much of an impact do they have on the baby when you are pregnant?
most important thing is to understand: are you a high-risk pregnancy or a low-risk pregnancy?
That's another big challenge in India because having a child for not just the parents, I think even more is the grandparents. How much has India developed in IVF and fertility treatments? How safe are they? The percentage of women in India getting reproductive issues is scaling up.
Yes. Social
Yeah.
taboos that we have in India surprise the reactions people give when they have the second daughter.
Oh.
It is so crazy. You know, as a doctor, you don't know whether to congratulate them or to say, sorry, this happened.
Despite all the medical advancement, are there still things we don't know? Why does it happen that till delivery we don't know कि क्या गलत हो सकता है? Normal delivery versus a cesarean delivery. Your last words of advice for people who are either planning a child, planning to conceive, or during pregnancy. तो चाइल्ड बर्थ इंडिया में एक बहुत इंपॉर्टेंट इवेंट है और चाइल्ड बर्थ कैसे ठीक होगा, अच्छा होगा, प्रेगनेंसी कैसे अच्छी जाएगी इज समथिंग दैट एवरीबडी इज वेरी कंसर्न्ड अबाउट. So I'm very happy that today we have an expert in our studio, Dr. Seema Sharma, who is the OBG director of Cloud9 and also the founder of Recurrent Pregnancy Loss Foundation. Dr. Seema Sharma, thank you so much for coming.
Thank you for having me.
So my first question to you is कि in India में child birth तो एक बहुत ही important चीज़ है.
जी.
और there are people who are not able to conceive, there are people जो pregnant हो जाते हैं but loss हो जाता है. What should people do? Are there very simple things कि ये खाओ, ये मत खाओ, ऐसा behave करो, ऐसा मत behave करो
Right.
to have a healthy pregnancy and a healthy childbirth?
Yes. See, the most important thing I would say is जो प्रेगनेंसी प्लान कर रहे हैं वो एक बार प्लान करने से पहले अपने डॉक्टर से ज़रूर मिलें. You need to start certain medicines, certain vitamins, जैसे फॉलिक एसिड है, जैसे आपको रुबेला का इंजेक्शन लेना है अगर आपकी इम्यूनिटी नहीं है रुबेला के लिए. डेफिनेटली आपको अपना वेट नॉर्मल रेंज में लाना है. आपको चेक करना है कि आपको थायराइड तो नहीं है, आपको शुगर तो नहीं है. अगर आपको है, अगर आपको एपिलेप्सी है, आपको मेडिसिन, आपको एंटीसाइकोटिक मेडिसिन चल रही हैं, एंटी डिप्रेशन की मेडिसिन चल रही हैं, आपको वो टेपर डाउन करनी है. एंड यू हैव टू मीट विद योर गायनेकोलॉजिस्ट एंड ऑल्सो विद योर रिस्पेक्टिव डॉक्टर्स, मे बी योर फिजिशियन, मे बी आपके जो साइकोलॉजिस्ट हैं, साइकाइट्रिस्ट हैं, जो भी आपको ट्रीट कर रहे हैं, उनसे आपको प्लान करने से पहले एक विजिट ज़रूर करना है ताकि आपकी मेडिसिन उनको टेपर ऑफ करें. देन ऑफ कोर्स यू हैव टू बी मेंटली रेडी बिकॉज इन इंडिया 80% population will just have an unplanned pregnancy. तो which is okay, not a problem. लेकिन कुछ चीज़ें जो आपको पहले प्लान करनी चाहिए वो आपकी रह जाती हैं. मोस्टली मैं देखती हूँ लेडीज़ आर नॉट रियली रेडी फॉर कंसीविंग. दे फील अब हो गया तो चलो रख लेते हैं. तो शादी जब आपकी होती है तो डेफिनेटली आपको अपने पार्टनर के साथ बैठ के ये बातें तो डिस्कस करनी ही चाहिए कि आपको बेबी का प्लान करना है, हमारे फाइनेंसेस कैसे हैं, हमें आगे कैसे चलना है. और आपको अगर नहीं चाहिए बच्चा तो आप कुछ कॉन्ट्रासेप्शन तो यूज़ कीजिए. आप अगर कुछ यूज़ नहीं करेंगे तो देर सवेर आपको प्रेग्नेंट हो ही जाएंगे आप. तो उस टाइम एक बार प्रेग्नेंट हो गए फिर सोचें कि आप इसको रखें कि नहीं रखें, अबॉर्शन कर लें कि नहीं करें. दैट इज़ नॉट रियली अ गुड सिचुएशन टू बी इन. सो ऑल दोज पीपल जो आप ये हमारा पॉडकास्ट देख रहे हैं, डेफिनेटली प्लान कीजिए और प्लान करने से पहले अपना मेंटल हेल्थ, अपना फिजिकल हेल्थ और मे बी अपने फाइनेंसेस को ज़रूर देखिए. बहुत सारी लेडीज़ हैं, गर्ल्स हैं जो मैं अगर कभी उनसे पूछती हूँ कि बेटा डू यू स्मोक, नो वी डोंट स्मोक, बट देन बहुत बाद में पता चलता है कि मैं वेप तो करती हूँ. सो दे डोंट थिंक दैट वेपिंग इज़ अ पार्ट ऑफ स्मोकिंग. सो हाँ, पार्टी ड्रग्स हम कभी कभी करते हैं, फिर बहुत बताते हैं तो हाँ हम फलाने हिस्ट्री नहीं बताते हैं, बोलते हैं ये हम एंटी डिप्रेसेंट्स ले रहे हैं. तो ये सब चीज़ें हमें पहले से मालूम होनी चाहिए. सो डेफिनेटली प्लान करने से पहले ये सब चीज़ों को आप ऑप्टिमाइज़ कीजिए. और फाइनेंशियल्स आर वेरी इंपॉर्टेंट इन टुडेज डेज. आप अगर अच्छे अस्पताल में जाते हैं तो चाहे आपकी नॉर्मल डिलीवरी हो या सिजेरियन, मोस्टली हॉस्पिटल्स ऑलमोस्ट सेम चार्ज करते हैं आपको. और अगर आप स्टैंडर्ड रूम की बात करें तो आपके चार्जेस अप्रॉक्सीमेटली 1 लाख टू 1.5 लाख सिंगल स्टैंडर्ड रूम में आपका खर्चा आता है। लेकिन आपको एक भेद की बात बताती हूँ। देखिए, ये जो हम बात करते हैं हॉस्पिटल्स के, भाई आपका पैकेज इतना है, ये पैकेज बेस पैकेज होता है। बेस पैकेज का मतलब है कि आप लेबर पेन्स में आए अस्पताल में, आपकी डिलीवरी हुई शांति से, आपका बेबी नॉर्मल है, आप नॉर्मल हैं, और आप दूसरे तीसरे दिन जितना आपका पैकेज है उसके हिसाब से आप घर चले गए। लेकिन अगर आपको कुछ भी ऊंच नीच होती है या आपके बच्चे को कुछ ऊंच नीच होती है, सपोज बच्चे को नर्सरी एडमिशन की जरूरत पड़ती है, उसको जॉन्डिस हो गया तीसरे दिन, वो सारे चार्जेस आपके बेस प्राइस में कवर नहीं होते हैं। और जब आप प्रेगनेंसी प्लान करते हैं तो आपको तो नहीं पता कि आप पूरा आगे तक जाएंगे या आपका बीच में ही बेबी हो जाएगा, प्री टर्म डिलीवरी हो जाएगी या कुछ भी कॉम्प्लिकेशन हो जाएगी। और अगर आपका बेबी नर्सरी जाता है तो आपको पर डे 8 to 10,000 का जो खर्चा है वो कोई नहीं बताता है पहले। सो व्हेन यू स्टार्ट अ प्रेगनेंसी यू नीड टू बी फाइनेंशियली इंडिपेंडेंट, बिकॉज बहुत सारे कपल्स मुझे बाद में बोलते हैं डॉक्टर साहब इतने तो हमारी गुंजाइश नहीं है, इतना तो हम नहीं कर सकते। तो थोड़ा सा पहले सोच के चलें तो बेहतर रहेगा। ऑल्सो डिलीवरी इज जस्ट पार्ट, इज द बिगिनिंग ऑफ द गेम। आपको जैसे ही बेबी होता है, आपका फर्स्ट बर्थडे, फर्स्ट दिवाली, फर्स्ट लोहड़ी एंड ऑल दोज फंक्शंस कम, एंड आजकल सब न्यूक्लियर फैमिलीज में होते हैं, सो ऑल दैट यू हैव टू ऑल्सो टेक अकाउंट फॉर। तो प्रिपरेशन इज ऑलवेज बेटर।
वाओ वाओ, so much information. और आपने 3 चीजें बोली which people should be careful about, which they have to prepare. So I want to go into each of those one by one.
Yeah.
The first you said is mental health.
Yes.
How is mental health impacting pregnancy and childbirth?
Look, mental health per se is of course important for anything. Women who are working, you know, they have to take into account that once the delivery happens, how much maternity leave she's going to get, what are her financials going to be, is your husband ready to support you financially or not, because husband, you know, women today are very independent. They have not really asked for any money from anybody. So once they are at home और दे हैव अ प्रेगनेंसी कॉम्प्लिकेशन, पहले ही जैसे ही प्रेगनेंसी हुई, ब्लीडिंग स्टार्ट हो गई, आपकी गायनोकोलॉजिस्ट ने आपको बोल दिया भाई आप फिजिकल एक्सर्शन अवॉइड करिए, आप ट्रैवल अवॉइड करिए, देर सवेर आप घर पे बैठे, आपकी नौकरी चली गई या आप वर्क फ्रॉम होम कर रहे हैं, जो भी। सो फाइनेंशियल लॉस, बोर्डम, डिप्रेशन, बिकॉज वंस यू आर होम पीपल स्टार्ट एक्सपेक्टिंग कुछ तो कर लो. So yeah, so you know, those kind of things she has also never, because when you're starting on, and especially in an emergency conception, you don't think account for those things. You feel जैसा सबका normal होता है, मुझे तो ये बातें पता ही नहीं थी.
Right.
So you know, it does lead to a lot of depression, and even after delivery, women are not used to. You know, she has to be. I had a patient who said, like, I'm a VP at a very big company, Dr. Sharma. You know, this motherhood thing is very over glorified. एंड शी सेड, मैं एक आवाज़ लगाती हूँ, 60 एम्प्लॉय मेरे खड़े हो जाते हैं यहाँ पे. आई एम एट द बैक एंड कॉल ऑफ अ स्मॉल बेबी, बेबी क्राइज, माई मदर इन लॉ कीप्स कमिंग के भैया रो क्यों रहा है बच्चा, तुम देख नहीं रही हो. सो इट्स इट्स वेरी फ्रस्ट्रेटिंग. इट इज़, you have to get ready that, you know, you will have every 2 hours you will breastfeed the baby, you will not get enough sleep. Your partner may say कि भाई तुम तो घर पे हो, मैं तो काम पे जा रहा हूँ, मुझे तो सोने दो. So those kind of things are very practical. Of course, I see a lot of change in men as well. I feel men are very becoming, you know, helpful, and they're changing their attitude, which is fantastic.
Right.
But still, women have to get ready about these things.
So you're saying the experiential mental health.
Yes.
The experience impact on the mental health.
Yes.
Because अब आप घर में हैं, आप के ऊपर pressure आ रहा है. You were a vice president and now you are at the beck and call of a baby.
Yes.
But I'm saying, what about people who are facing, let's say, depression or some mental health issue?
Yes.
And become pregnant?
Well, that's okay. You know, depression is part of, it's okay. It's like any other problem, right? So if your depression is under control with medicines, it's fine. But the medicines have to be fine-tuned to the needs of pregnancy, and you have to keep meeting your psychiatrist once in every trimester to fine-tune. जैसे आप pregnant हो रहे हो, आपका blood volume change हो रहा है, आपकी dose बढ़ानी पड़ेगी, आपको safer medicines पे shift होना पड़ेगा. So if you're controlled, it's fine.
अच्छा. Now coming to physical. So I'm assuming you're suggesting to people have a good diet and all that.
Yes.
But going back to what you mentioned about smoking, drinking, substance, drugs,
right,
all that kind of stuff. How much of an impact do they have on the baby when you are pregnant?
Impact will depend on what is the amount that you consume.
Okay.
If you are a heavy smoker, अब हम दिल्ली में एक दिन में वैसे ही everybody is
Heavy smoker
consuming
तो सब हैं
20,
यहाँ पे।
हाँ, तो there is no point asking. But beyond that, mostly women are not very forthcoming as to how much. They say occasionally party में, but they are actually smoking a lot. So then we do say कि भाई आप छोड़ सकते हो तो fantastic, because again preconceptional counseling और उसका बहुत फायदा है कि आपको टाइम मिल रहा है कुछ करने के लिए, तो आप उस टाइम पे आप मेडिसिन खा सकते हो, एंटी स्मोकिंग, आप नॉर्मल सिगरेट से में भी वेप पे आ सकते हो जिसका थोड़ा सा इफेक्ट कम होता है आपकी बॉडी पे। आप ड्रिंकिंग कर रहे हो तो थोड़ा सा कम करो ड्रिंकिंग, आप अपना पार्टिंग कम कर लो, पैसिव स्मोकिंग हस्बैंड को बोल के वो भी थोड़ा एटमॉस्फेयर आप चेंज कर सकते हैं। सो स्टॉपिंग इज आइडियल. In an ideal world, nobody would smoke, drink, or have party
Right.
drugs, but sometimes it is not possible. So whatever you can minimize is okay.
तो स्मोकिंग ड्रिंकिंग का नेगेटिव इम्पैक्ट तो है ही।
For sure, you can have, if you are a heavy smoker, like all of us are in Delhi, small birth weight babies and placental issues, growth issues. आप अल्कोहल ज़्यादा लीजिए तो एक बहुत सिंड्रोम होता है, fetal alcohol syndrome. तो उसमें बेबी की इंटेलेक्चुअल कैपेबिलिटीज, स्कूलिंग, ऑल ऑफ दैट कैन गेट अफेक्टेड.
Oh.
Yes.
Okay. So recommendation is stop.
Stop. Totally.
Right? But somebody who's a heavy smoker or drinker, of course, will not stop.
Yes.
So you're saying at least reduce.
At least. Whatever you can do to minimize, please do that.
And whether you reduce, don't reduce, at least tell the doctor.
Yes.
And if you tell the doctor, what can the doctor do really? They can give you some medicine for it?
There is a medicine, yes. But that has to be given under supervision of a psychiatrist.
Oh.
Yes.
Okay.
For anti-smoking and even anti-alcohol, there are medicines available.
Okay.
Provided you have that much time. If you already have conceived and first 3 months are gone by the time you're coming for this conversation, then it's of no use.
Right. Okay. And the third thing you mentioned is financial preparation, which is very interesting. So, and you mentioned a number about a lakh, right? About a lakh is the cost of a delivery, as long as everything goes well. Now, there are two questions that come to my mind. One is the lakh an average? Like, are there 5-star hospitals that are charging 10 lakhs?
No, so this is like a 5-star hospital I'm talking about, but the basic entry room.
Okay.
But in the same hospital, if you go for, say, a deluxe room or a suite or a presidential suite, obviously your bill will run in lakhs, multiple of lakhs, 10 lakhs or 8 lakhs or something like that.
So a lakh is about the minimum in a good hospital?
Yes.
Okay, and the maximum can be anything?
Can be anything.
And what about the minimum? Like India is full of people who can't afford a lakh.
Well, government hospitals are free, but then smaller nursing homes, depending on the size, 40, 50, 60.
Right. Okay. The other question that comes to my mind, which, I look back at when I had kids, or my wife had kids, the question we had is, which is a good hospital? Yes. And normally it goes on to your gynecologist, because you've been going to this gynecologist for a long time. So gynecologist says, I sit in this hospital.
Yes.
So then you go to that hospital.
Yes,
but in your mind, you're always wondering.
Yes.
I also know people who, when the lady got pregnant, said, we will go to the gynecologist who goes to this hospital.
Yes.
Because we want that hospital. So how do you figure out which is a good hospital for my child's delivery?
Right. So I normally tell my couples that, first is you should look at your finances.
Okay,
Don't
fair.
aim at the sky if you can't afford it.
Sure.
One. Second is, of course, you need to look at what are the facilities that the hospital is offering. Is the hospital having a NICU setup? Are you a high risk pregnancy? अगर आपका सब कुछ नॉर्मल है, आपको हाई रिस्क नीकू की जरूरत नहीं है, आपका लेवल 1 से काम चल जाएगा, आपको लेवल 4 नर्सरी की जरूरत नहीं है. So, and of course, the distance from the hospital, how are you going to reach, traffic time, peak traffic time, and your gynecologist, and basic infrastructure to make you comfortable. आपको जो चाहिए वो उस अस्पताल में है या नहीं. Essentially, from a doctor's perspective, finances, distance, and the NICU.
Okay.
The NICU, neonatal ICU.
Okay, but आपने जो लास्ट बात बोली कि जो आपको चाहिए वो है या नहीं है, पेशेंट को तो मालूम ही नहीं है मुझे क्या चाहिए.
नहीं, पेशेंट को मालूम है मुझे. हाँ, that is okay, but also, you want your guests taken care of in a certain way. Those rooms.
Okay.
What strata you're coming from, all that matters.
Right.
And does, in case of any problems, and that most important thing is to understand, are you a high risk pregnancy or a low risk pregnancy?
Okay.
Of course, any pregnancy can turn into high risk at any given point. But to begin with, आपने शुरुआत ही करी 125 किलो का आपका वजन था, आपका शुगर इंसुलिन से ही कंट्रोल हो रहा है, आपका बीपी बहुत ज़्यादा हाई है, you're likely to get into trouble. You may have a premature delivery, baby will need nursery, you will probably need expert physician help, you may need to go to ICU for some time, everything can happen. So that thing you need to see.
Okay. So the other question is about people who are not able to conceive.
Yes.
Right. So that's another big challenge in India, because having a child for not just the parents, I think even more is the grandparents. Right? कि अब शादी हो गई, अब बच्चा कि आप बस हमारे को मुंह दिखा दो and show us the grandchild. But there are people who I'm assuming have medical issues and are not able to conceive.
Yes.
And there comes things like IVF and fertility treatments and all that. How much has India developed in IVF and fertility treatments? How safe are they? And how does one decide where to go?
Well, this is a very broad question you have asked me.
Sure.
To begin with, India is at par with the best.
Okay.
We are having a lot of medical tourism. We get patients from abroad to kind of have IVF because we are quite affordable in terms of IVF and also fertility treatments. So fertility treatments can start from tablets to injections to IUI to IVF again is a big umbrella wherein, you have different types of treatments available.
Sure.
By and large, very safe. But everything has a pros and cons. If you come to a doctor, you're spending time with the doctor, you're spending money, you're spending your emotions, and then, you fail, then all those things are there. But by and large, these injections are very safe. And a lot of people, if they give a good history, क्या होता है कोई आपको सपोज फर्टिलिटी ट्रीटमेंट चाहिए, आप पहले तो अपने मोहल्ले के डॉक्टर के पास जाओगे, वो 2-4 ट्रीटमेंट देगा, फिर आप किसी और के पास जाओगे, फिर आप किसी और. So, the total number of cycles, nobody is keeping track of. So, if you are, say, under 6 or 8 cycles of stimulation, we are okay. But if you go like a lot of people will say, 8 usse, 6 usse, 6 mahine uska treatment, essentially everybody is giving the same treatment. But since there is no central registry in our country, if you go beyond 12, then yes, your risk of ovarian cancers, breast cancers, other smaller issues will go up. These are the most sinister side effects anybody can have.
Oh.
Yes. So it's very important to keep track of किसने क्या दिया. पेपर दिखाएंगे आप डॉक्टर को तो वो हिसाब लगाएंगे. अगर आप ऐसे ही उठ के चले गए कि जी हम पहले उनसे ट्रीटमेंट लिया था, सक्सेसफुल नहीं हुआ, आपको पता नहीं आपने कौन सी ड्रग्स खाई, उन्होंने कुछ इंजेक्शन तो दिए थे, यू डोंट नो व्हाट इंजेक्शंस वर गिवन. So that is not a good approach. So patients also should be keeping all their paperwork.
And what about and if you're okay to share, what about the cost of these things?
Well, cost depends on which treatment. So if you're taking say basic, if you take, you need tablets. Tablets are very cheap. So the cost of the cycle will be, including all your consultations, on an average will be 4,000-5,000.
Okay.
Very cheap. IUI in most hospitals is from around 5,000 to 10,000. IVF on an average, basic treatment, 1.5 lakhs.
Okay.
Yeah, per cycle.
Per cycle?
Yes.
And how many cycles on average?
One cycle, if you're lucky, you will conceive in the first go. And if you have embryos, then you don't need to have the whole cycle again. You just need an embryo transfer. So if you want to start the cycle again, we say 3 cycles of IVF.
Okay.
Yeah.
3 cycles. So 1.5 times 3.
Yes.
4.5 plus 1 for delivery.
Yes.
So 5.5.
Yeah, much more actually.
Okay.
Yeah, much more, because so many things, you're taking off from office, you're not going.
Of course,
that
of
is.
Course. Of course. But it could be 5, 6, 7 lakhs.
Yes.
If you're going through that entire treatment.
Yes.
Right. Okay. And those treatments are happening when people are not able to conceive, they have reproductive issues.
Yeah.
I also read somewhere that the percentage of women in India getting reproductive issues is scaling up.
Yes.
It's going up like crazy.
Yes.
Is there a reason for that?
Yes. The reason is, we are all getting married late now.
Oh.
Second, we are generally a very unhealthy population. Insulin resistance, sugars. I mean, I hardly now see any pregnant patients who has nothing written ahead, in diagnosis. patient will have either a diabetes or a blood pressure or a thyroid issue or PCOS or something like that. Hardly anybody who is totally like kind of no high risk factor. So yes, it is our lifestyle. It is the way we have been brought up as children. Again, the issue of girl safety. बच्चों ने कभी खेला नहीं, माओं ने कभी उनको बाहर नहीं भेजा. You know, you always need to tag along with an आया. How much बाकी बच्चे नीचे नहीं आया खेलने के लिए, तो आप किसके साथ खेलो? So children are as girls, they don't play, they don't utilize their pelvic muscles. So you know, a lot of they have a protruding belly by the time they are 23, 24. All of us, Indian diet is very carb predominant diet.
Right.
And we don't exercise.
Oh, that's very interesting. So you're saying India by nature,
yes,
our population and our culture is driving some of these problems because late marriage, girl is not going out to play, so there is no physical activity, muscles are not getting developed. Your diet is an issue, your safety is an issue, marriages are getting delayed now.
Yes.
So all this is causing problems
yes, to conceive. Also, a lot of couples, very unique problem India has is a non-consummation of marriage. You don't see couples like that abroad at all. That, 10 years you've been married and you've never consummated your marriage. You've never had a penetrative sex. A lot of it is like how girls are brought up, that good girls don't do this, good girls don't do that. Nobody talks about these issues, so the woman is totally close to it. So she finds it very abnormal, There is a huge percentage of people who have never consummated their marriage. And you will be shocked, when they come to us, even like married. Now we want a child, married for 10 years. So when you start taking the history, then the husband will shyly say, well, we've never had relations. So, they feel they will be judged. Ki, Arey Baba, itna time ho gaya, ab aa rahe ho. Aisa kaise, are you a man or what? They feel kind of that this is, but it is not seen anywhere else. So this is again another problem. A lot of infertility couples
and
actually.
But why? I mean, for 10 years, why?
So, they don't know, about the sexual process sometimes. Sometimes a woman is totally close, so they say, okay, aaj nahi karenge, baad mein try karenge, all that, so time keeps lingering on to a point that the man will also lose interest and will say, acha, when they have to conceive, then of course they have to do it. So they are as a couple okay doing other things, but they don't want to do a vaginal penetrative sex, so it's okay. But then when they want to have child, they have to do that.
Right. My God.
Yeah.
And you're saying that's not a very minuscule, small percentage.
No, it's not. So many times even doctors will not take this history because if you don't make a couple very comfortable, they are not going to share it with you.
Right.
So I have seen couples come to me with this investigation, that investigation, and if I talk with them and they will say, well, I don't know whether we've done it or not also. So,
wow.
Yeah.
And so if you had to guess, what's the percentage of such people?
See, I don't
Or
run
how many such people would you have seen? Number?
Plenty. Thousands.
What? Wow.
Oh, like I've been in practice for 30 years now, but
wow.
Yeah.
Wow.
So.
Wow, this is shocking.
It is shocking. And because nowhere else, because most of the other societies are fairly okay with this, abroad, like you go to America, UK and all, people are okay having sex anytime, the taboos, that social taboos that we have in India, that we are the most populous nation.
Yeah.
We don't know about contraception. We don't know about the sexual act. We don't know how to, protect ourselves.
Right.
So, it's very, the social dogma.
Yeah. Wow. Again, comes back to our cultural challenges that we've created, that we feel very proud of actually.
Yeah.
And but we don't realize that our own kids are going to suffer with this.
Yes.
Wow. Okay. And then there are people who do get pregnant, but lose the baby.
Yes.
Right. There is, of course, the loss that happens.
Yes.
Are there any clear, strong reasons why this happens?
Well, every couple, I mean, there's a set percentage that we say. If I say 100 couples, see 100 couples in my clinic, out of that, 10 to 15 would definitely end up losing one baby.
Oh.
That's a simple abortion, a simple miscarriage. It is, I'll give you an example. So WHO, the World Health Organization, says if a man has 4% normal sperms, the man is normal. You flip it, that means 96% abnormal sperms, man is normal. So if, say, 100 sperms were being released at one particular act of being together, if there are 96 abnormal sperms, one of them have just formed faster and met with the egg, but the resultant baby is not going to be normal. Now, nature has its own ways to kind of shut off those abnormal sperms. But maybe in that particular cycle, the nature's mechanisms failed, or the egg was abnormal in that cycle. So the resultant baby would not thrive, which is okay. That's nature's failure. So the failure rate is 10 to 15%. The problem happens if you lose repeated pregnancies. So we call them, if a couple has lost 2 or more pregnancies consecutively, we call it recurrent pregnancy loss. Now, those are the challenges that we face.
Okay.
Yeah.
Okay.
With one loss, usually people will not have problems conceiving again. They will not end up into miscarriages. They'll likely not have any challenges in the next conception.
So one is not
Not
a
a
monster.
problem. Yeah.
One is more common, and the next one could be fine, and you
Yes.
don't need to get
and
too
you
worried.
don't even need any special kind of test with one miscarriage.
Okay.
Yeah.
But when it becomes 2, 3, 4,
Then it's a problem.
now there is
Yes.
a repeated problem that is happening, so you need treatment.
Yes.
Okay. Okay. And is that, again, treatment which is easy, reasonable?
I would say treatment is reasonable, provided we get to the reason of it.
Okay.
Yeah. So when a couple loses 2 or more pregnancies, we label them into the recurrent pregnancy losses. So it can happen. The loss can happen anytime, say in the first 20 weeks, it's again a loss. So early pregnancy losses usually have a genetic issues, or they have antiphospholipid syndromes. I mean, I'm just getting technical here, but we don't need to. And in whatever we may do, in like 40 to 50% couples, we don't come to know of the reason why this happened. But still, even after, say, 4, 5 losses, there is a fair amount of chance that, next time the baby would be normal.
Okay.
So, yeah, the investigations can run into huge amount of money and effort. But despite everything, we may still not come to know of the reason why this happened.
Okay.
Yeah.
Okay. Okay. And the other big debatable thing in the society normally is that we want a boy child.
Yeah.
Right? And now I know people go to Babas and Pandits and, whatever, temples, and even the Pandits say, कि यहाँ पर ये कर दो तो आपके लड़का होगा, and all that. I mean, hopefully that is changing with the new generation. But having a male child in India is considered like,
Yeah, the nirvana.
Nirvana. कि मेरा वो उत्तराधिकारी, my legal heir has come, and now my name will
Still.
continue because लड़की तो चली जाएगी, नाम बदल लेगी, whatever. And this might sound like a stupid question, but I think I've met enough educated, capable, smart vice presidents of companies who believe it is possible to do things with which you will have a male child. So is that possible?
Well, to a certain extent, there are some things.
Okay.
But I wouldn't divulge into that because, this topic is really covered by it is a very censored topic
Of course,
in our. The reason is we have this special act in place, which is PCPNDT, wherein, you have to do nothing to do with sex selection at any point in your journey. So even if to advise a couple to how to go about a male child, you're not allowed.
Okay.
So, yeah. So, they go do their Google searches and whatever it says, let's do this, do that. People keep doing a lot of stuff.
Yeah,
but I tell everybody, देखो 50% तो वैसे ही लड़का होएगा ना.
Right.
बाकी इससे ज़्यादा चाहिए तो maybe पंडित से ही पूछ लो तुम्हारा पुत्र योग है कि नहीं. So go accordingly.
Right. And then comes a point which you might not even be aware of because you are a doctor who's helping people have babies. But India historically has had a significant number or percentage of female infanticide, right? Where the female child is given up, or I have no idea what happens to it. Do you have any knowledge or insight of that?
Yes, of course.
Okay.
A lot of couples, especially, I wouldn't say rural, I think it's moneyed people as well, educated people as well. When they don't want a girl child, they probably would go to any extent. See, the PNDT Act is very strong. So now we cannot divulge the sex of the child on ultrasound. But, people go abroad, they go to, say, Middle East countries and all, where there is testing available, so they come back, and, if no doctor is available, they just pop in a abortion pill from somewhere XYZ source. To an extent that, yes, we are at the moment, the latest statistics are very, very dismal. We have only 923 girls to 1,000 boys. So boys are so much surplus, and people are not getting good girls to marry with.
And this is
That
gonna
is
create
another
many
reason,
issues.
yeah, the violence is going up, because they are not having enough girlfriends, and not having people to date or people to marry.
Yeah.
All of that.
Wow.
So the discrepancy is growing up with the passing number. So all these acts and all are not having any effect.
And you're saying
Because-
this discrepancy might not be just natural.
No, it is not. Otherwise, ideally, you're supposed to have more number of girls as compared to boys.
Achha.
Because of natural selection, girls are supposed to be sturdier, even as infants and as babies.
Oh.
Yeah, by nature. But then if you see most of the countries, they would have unequal, or women are slightly in surplus. But in our
Okay.
country, there is so much lag, and still people are running after boys.
Okay. So you said there is some abortion pill
Yeah.
that people can have. Are these just available off the shelf?
There are people, actually government says you have to have a prescription
Right.
from the doctor, but the amount of number of people I see who have just taken them off, and I don't think anybody cares.
Mm-hmm.
Yeah. So pharmacy is not under anybody's control.
But aren't people scared? Like a mother who's going to take this pill
Yeah.
might not know if it is
herself
safe
is-
for me to have this pill right now.
Yeah, they keep Googling, and then they say, okay, if there is any problem, I'll go to the hospital.
Like if your pregnancy has already lasted for a certain period and you're having this pill, I'm assuming it could lead to some problems
It can
to the
sometimes
child
lead to
and
a
the
lot-
mother.
So she doesn't want the child anyway. So
Right,
she's not
right.
worried about the child per se.
Right.
For her own health, well, yes, if something will happen, they will take because she's so indoctrined, because she feels her survival in the house is also dependent on whether she produces a boy or not. Or especially if she's had one girl child. A lot of couples would come to doctors. I'm sure everybody else has the same experience as I have. So they say, डॉक्टर साहब आपको तो पता ही है, पहली लड़की है, आपसे हुई थी, अब बताओ, अब हमको दूसरा करना है, कैसे करें, क्या कर सकते हो, आप कुछ हेल्प करोगे कि नहीं, So indirectly they're asking you if there is a girl child that you see, will you tell us or not?
Right.
So, so every time, you have to kind of scold them or, twist them away that, bhaiya, aisa nahi hota
And
hai
you're saying
India
this
mein."
is not just happening in the poor, lower middle class income families.
No.
This
it
is also the rich
happening-
and the qualified and
Oh,
the
yes.
capable.
Yes. I see that class only.
Oh,
Yeah, because
Yeah.
So, and you will be surprised the reactions people give when they have the second daughter.
oh.
It is so crazy. As a doctor, you don't know whether to congratulate them or to say sorry, this happened, and it's really, and also amongst doctors and medical fraternity, it's a very interesting concept that we have. We always red flag the file. Second daughter, they are going to find fault in everything. So sisters are told take care of them, and bill के लिए लड़ाई करके जाएंगे.
अच्छा.
हाँ, second daughter. तो वो
If they had a boy, they won't.
No. So it is a thing, हम आपस में, it's a done thing कि अच्छा वो हर बात में sister की गलती निकाल रहा है. Sister didn't come in time, दवाई नहीं ठीक मिली, drip खत्म हो गई थी, आई नहीं 5 मिनट तक, diaper नहीं change करा. So we say okay, fine, कोई बात नहीं.
So, how many patients do you see in a month or in a day, or how many pregnant cases do you see? Approximately.
1,000. I mean, because
So
they're not new patients, they're repeat
I'm just trying
patients
to
as
understand what is the percentage of people that you see who are fussed about it, who are wanting a boy.
Everybody. Almost everybody. Almost everybody. There are very few couples who do not express emotions when, the second girl is born. They were always like, you hear
That's
people
really
complimenting them. कोई गल नहीं हो गई थी, कोई गल नहीं, मतलब like there is no problem, कोई बात नहीं हो गई जी, हो गई हो ठीक है जी, कोई गल. So girl is like not a congratulations thing, it is like कोई बात नहीं हो गई तो.
Oh my God, it's so sad, so sad. You being a woman, how do you feel about this?
We're used to it now. I guess, you are like, there are certain couples who are like specimens. Then, you will discuss and amongst your friends and say, oh, उसने ऐसा reaction दिया, उसने ऐसा. By and large, you kind of by now used to it कि ठीक है, वो ऐसे ही है. So what can you do?
Yeah, wow.
earlier हम बैठ के समझाते थे कि अरे नहीं, girls are as capable, हमको भी देखो. But I'm like, you feel it's a waste of your energy.
I was asking you the number, how many patients do you see every month? And in my mind, I was thinking when I ask you this question, I will say, 1,000 mein se, how many are so fussed and they want only a male child? I thought you will say 20, 30. I was thinking, will it be more than 10% or less than 10%?
जिनका पहला लड़का हो जाता है ना, then they keep harping, I need a girl, I need a girl.
Okay.
But it's like essentially to complete a family. People who have a first daughter, nobody would say I'm okay with the second daughter. Very seldom people will say. They say, अब देख लो, अब तो लड़का ही हो जाना चाहिए types,
Wow.
So.
Wow. Or people who are having their first child, do they also want a boy only? Or they are more balanced?
They feel the first is they're more balanced. But then they will also say, लड़का हो जाए ना तो आगे के लिए tension खत्म हो जाती है. That way. But they would not fuss it कि चलो लड़की हो गई. But some families, even for the first one, they will fuss. Yeah, they will say,
Amazing, scary. We are a scary country. I'm assuming, you worked outside India also. You've been a global doctor. These things, I'm assuming, are less in the West.
Yes, much less. Much
right?
less.
If you're in
Mostly,
UK,
if you
US.
see Europe and US, people are happier having daughters because they feel daughters are more attached and, they bring in a certain delicate energy into the house.
Yeah.
That.
Yeah.
Here in India, people want girls only if they've had their first son.
Right.
Yeah.
Right. It's crazy. The other thing, so before you had to come, I was researching about, pregnancy. And one of the things that popped up is folic acid.
Yes.
A lot of websites have talked about consumption of folic acid.
Yes.
So why is that important?
See, folic acid is part of multivitamin group, to say it broadly.
Okay.
So, if a woman has a deficiency of folic acid in her system, baby is more likely to have brain defects and central nervous system defects.
Oh.
So, when a woman, so we hardly ever check the patient for folate levels,
Okay.
So we by and large have made it a protocol कि every woman, हर एक औरत जो conceive करना चाहती है, conceive करने से 2-3 महीना पहले it used to be 3 months and now they have brought it down to 2 months. कि 2 महीने पहले conceive करने की attempt से आप ये folic acid start कर दीजिए. 1 tablet 400 milligram per day, mcg per day, every day till you conceive. And you need to continue it till 8 to 10 weeks of pregnancy. So मतलब 2-3 महीने पहले and first 3 months into the pregnancy, you need to continue taking folic acid.
Okay.
And also Indians में हमारे में एक म्यूटेशन होती है जो बाहर में इतना ज़्यादा कॉमन नहीं है, लेकिन इंडियंस में थोड़ी कॉमन होती है. तो उसमें हमारी बॉडी जो है प्लेन फॉलिक एसिड को अब्जॉर्ब नहीं कर सकती.
Okay.
And since that testing is expensive, difficult, not many people would do it. तो हम लोग मिथाइल फोलेट देते हैं rather than plain folic acid.
अच्छा.
When I was a medical student, I was in government hospitals. So we used to see lot of babies born with anencephaly. Anencephaly is a condition जिसमें ना सिर नहीं बना है बच्चे का. मतलब ये ऊपर की हिस्सा नहीं बना है. So there is no brain. It's an empty thing. So baby has a face. It's an empty thing. It was quite a common situation. और उस time ultrasounds होते नहीं थे. तो एक्सरे पे बोन्स स्कल की दिख रही हैं कि नहीं दिख रही, उससे हमें पता चलता था. क्लिनिकली हमको देखना पड़ता था कि हेड है बच्चे का कि नहीं है.
Oh my God.
But now we don't see it at all. So this is courtesy folic acid introduction that has happened.
Okay.
Yeah. So lot of पहले बहुत होते थे spinal cord defects और anencephalies and all. Now we don't see them. I don't think आपके new doctors कभी देखे भी होंगे वो सब चीजें.
Right.
वो सिर्फ jars में specimen होगा तो दिखेगा. We used to see them left, right, center.
My God.
Yeah.
My God. Okay. Now, the other thing that you talked about was young mothers or mothers who are saying, I'm going through depression because I'm a vice president and this is happening and all that. Now, how does that vice president or whatever take any title? A lot of women today are working, which is a great thing, which is very, very nice. But when they're working, they're also working in high stress environments, right? So the vice presidents of the world have stress, whether you're a manager or whatever you're doing. I mean, we've seen recently cases about people working in the corporate world attempting suicides. And the corporate world or the work environment has stress. There is no doubt about it. Now, for a pregnant mother or expecting mother who's pregnant, going through pregnancies, facing challenges anyways, how does that stress impact her or impact her pregnancy? Should she ideally take time off? Is it actually better to go and work and it's okay if the stress is there? Should they move to a less stressful environment of work? Should they ask for a transfer to a easier department to work? How does stress and work stress or all kinds of stress, even homebound stress, impact their pregnancy?
Yeah. So unfortunately, we don't have any test which can quantify stress.
Okay.
So I usually tell this to every woman that, look, you have to decide for yourself. There is a patient, there would be a person who is just going next door for work. For her, getting out of the house is okay. She gets money and, her work is not very stressful. She's okay doing it. Then there is another person who has to travel 2 hours one way. She gets stuck in traffic, high stress job. Well, then I say, well, if you can't cope up, then leave. See your finances yourself, see your mental condition yourself. This is not something that I would advise, but then, there are patients who say, ma'am, aap hame work from home ka de do. That's okay. I say, when you can't manage, I will give you a certificate work from home. If you can do it, fine. Whatever ways I can help you, I will do. But the decision to do what is yours. Can you handle it? Can you? Because मजदूर हैं, वो तो आप देखो 8th month में भी 3 stores पे जा रहे, 3 मंजिलें चढ़ रहे हैं सीमेंट की बोरी लेके, उनको कुछ नहीं होता है.
Right.
There is another group who says कि यार मेरे को यहाँ से Connaught Place जाना बहुत taxing लग रहा है because traffic है and all that. So every person to themselves. So I usually joke with couples. I said, Mughal garden का गुलाब और जंगल का गुलाब फर्क है. You have to decide where you belong.
Oh, that's so sweet. That's so sweet. Yeah. Interesting. That's an interesting point. Now, the pregnancy is happening. The lady is going through the checkups and treatments and all that is going through. Now, during the delivery, there are times that I've heard the child was born dead, or the child was born with some sort of ailment or some disability or whatever.
Yes.
Despite all the medical advancement, are there still things we don't know? Why does it happen that till delivery we don't know कि क्या गलत हो सकता है?
Well, now that with the testing has become so much better, there are very seldom these cases where we don't know.
Okay.
Majority of the cases, things are picked up on ultrasounds, things are picked up, and also we know but still, yes, there are certain things, storage disorders in the baby. For that, we would not know.
Mm-hmm.
And for that, we usually, if such a mishap happens, we usually tell the couples go for an autopsy for the baby so that we know the reason, so that we can be more careful for the next one.
Okay.
Yeah.
Okay.
But for majority, we are able to identify the risk factors in the antenatal period.
Okay. So medical science has reached a level where
you see, childbirth is a difficult experience.
Sure.
We still have mothers who lose their lives. We still have babies who don't make it. We have babies born in critical condition who are like vegetables after they are born. Those kind of percentages would never be zero. They happen here, they happen anywhere else in the world as well. So we have to accept that there's a few certain percentages which will belong to that category.
Right, right.
But majority we are able to sort out before, and before mishap happens, we are able to intervene.
Yeah. The other big thing that couples or expecting mothers discuss and think about is normal delivery versus a cesarean delivery.
Yes.
Right.
Yeah.
That's I've had 2 kids and my cousins and friends and everybody's had kids. And this is a common topic. कि आपकी delivery cesarean हो रही है, normal हो रही है.
Yes.
What do you want? What is happening? And the other perception is that cesarean is more expensive. Cesarean makes the hospital make more money. So they will recommend cesarean. These are all perceptions, or were at least earlier.
So
right?
I'll interrupt you here.
Yeah.
Because hospitals don't make more money on cesareans. Why?
Okay.
Because the person is going to theatre. You need an anesthetist. You need the anesthesia drugs. You are going to stay in the hospital a little longer. So hospital makes lesser amount of money on a cesarean because your sutures are being used, your medicines are being used, and the package remains almost the same.
Okay.
So hospitals don't make. Even doctors are now being paid equal amount. And why this has started is everybody used to say, doctors kar rahe hai cesarean. So because they want more money. So corporates have now made it equal so that contention doesn't happen.
Okay.
अब हम equally charge कर रहे हैं आपको, वो that is not a criteria के, but उसकी वजह से जो जनता जिसका नॉर्मल डिलीवरी हो जाना था, जिसको 50,000 पे करना था, that is also now spending 1 lakh for a normal delivery. You see, people are actually the sufferers.
राइट. So ऐसा नहीं है कि सिजेरियन कम हो गया,
हाँ,
और नॉर्मल डिलीवरी बढ़ गया.
हाँ, नॉर्मल डिलीवरी का चार्ज बढ़ गया.
राइट.
तो सिजेरियन तो उतना ही था.
श्योर.
और पीपल स्टिल कीप ब्लेमिंग कि नहीं ऐसा, उससे कुछ फर्क नहीं पड़ता. व्हेन दे स्टार्ट ब्लेमिंग द डॉक्टर्स, दे देमसेल्व्स आर द सफरर्स, आई फील.
श्योर.
देयर आर कपल्स, यू नो, यू वुड से आपने जो कहा हम कर लेंगे, दे आई फील रिमेन इन द बेस्ट बेट. People who argue, Google, this, that, you know, eventually they end up spending more money. Eventually जो होना है वो तो होएगा ही. So that way.
But in terms of the delivery and its impact on the baby and the mother, is it better to have normal or better to have cesarean? I mean, there are people I've heard from who have said that cesarean is just clean. उसमें pain तो है ही नहीं, तो आप जाओ, उसमें कट लगेगा, आपको एनेस्थीसिया डाल देंगे, बेबी निकालेंगे, उसमें आपको स्टिचेस लगा देंगे, तो you have less pain. There are people who have also said that the normal delivery has, there might be more delivery related pain, but it also is health-wise better for the baby. Now, again, I don't understand the D of doctors, so you're the best person to give more insight.
So I'm so happy you asked me this question, because everybody has this thing in their head that, look, the comparison itself is not valid. You're saying normal. Normal means everything, by definition, everything is normal.
Yeah.
है ना, माँ को भी ठीक है, बच्चे को भी ठीक है.
Right.
The problem happens when we are comparing a complicated vaginal delivery versus a cesarean section. First cesarean versus a complicated vaginal delivery, cesareans are better, I would say. Rather than landing up the baby into a cerebral palsy, baby stuck हो गया, shoulders फंस गए, you know, stitches extend हो गए, rectum got opened. All those things are complications. Or, you know, head was not coming down, खींच के निकालना पड़ा बच्चे को, कभी उसका shoulder टूट गया, कभी Erb's palsy हो गई. Those kind of things are problematic for the doctor and for the patient also.
Sure.
Forceps लगाया, vacuum delivery करनी पड़ी, all those. But normal any day is better.
अच्छा.
अगर आपका normal है, आपका सब कुछ ठीक ठाक हो रहा है, normal by definition means there is no additional risk to the mother or the baby. Normal delivery is any day better. See, first cesarean, again, it's become so common, everybody has become an expert. आजकल नए डॉक्टर्स को एक्चुअली नॉर्मल डिलीवरी करना ही नहीं आ रहा है, बिकॉज इतनी कम हो रही है नॉर्मल डिलीवरी, तो वो जल्दी से गिव अप कर रहे हैं, बिकॉज दे हैव ओनली बीन ट्रेन्ड इन सिजेरियन सेक्शंस. एंड व्हेन आई वाज वर्किंग इन अ गवर्नमेंट सेटअप, हम ट्रांसवर्स लाई, ठीक है, बच्चे की टांग खींच के निकाल दी, ब्रीच पे भी निकाल दिया. वी यूज्ड टू डू ऑल हेरोइक्स, नोबडी वुड स्टॉप अस बिकॉज दे वुड ऑल बिलीव इन अस. एंड ऑल्सो कपल्स बोलते थे कि नहीं डॉक्टर साहब, बच्चे को कुछ होता है, माँ को कुछ नहीं होता. सिजेरियन हैड अ रिस्क, तो वो बोलते थे नहीं ये कैसे भी करो, ये गया तो दूसरा आएगा, कोई बात नहीं, बट मुझको सिजेरियन नहीं करना है. सो वी वर ऑल्सो फ्री टू डू थिंग्स दैट वी वांटेड टू डू. आजकल ना द तलवार ऑफ मेडिको लीगल थिंग इज सो मच बिकॉज पीपल आर जस्ट नॉट एक्सेप्टेबल, दे आर नॉट एक्सेप्टिंग एनी थिंग गोइंग रॉन्ग विद द मदर और द बेबी. मदर को तो नहीं पूछते, इतना बेबी के लिए बहुत सेंटी हो गए हैं कि बच्चे को कुछ नहीं होना चाहिए. So obviously doctors are also resorting more to कि जरा सा भी प्रॉब्लम लगता है, ये बच्चा फंसेगा, बच्चे का साइज बड़ा है, मदर ने एक्सरसाइज करी नहीं है, pelvis muscles उसके हैं नहीं, pain she cannot tolerate, she also has very, it's very funny, you know, when we go see patients, patient will hold your hand, डॉक्टर साहब अब तो आप सिजेरियन करके ही जाओगे, and बाहर निकलो तो मदर इन लॉ विल से नहीं डॉक्टर साहब आप ना कोशिश पूरी करो नॉर्मल के लिए. So you know it's a
So why does the mother-in-law want normal?
बिकॉज शी फील्स वो सिजेरियन होएगा तो लेटी रहेगी, उसका देखभाल करना पड़ेगा, स्टिचेस हील नहीं होंगे. शी इज थिंकिंग फ्रॉम हर टाइम एंड डॉटर इन लॉ इज थिंकिंग फ्रॉम हर साइड, यू नो, दैट आजकल तो सब सिजेरियन करते हैं, जल्दी हो जाता है, मुझे पेन्स नहीं लेना है. सो बेसिकली इफ एवरीथिंग इज नॉर्मल, सी आई वुड अगेन से दैट यू नो यू नीड टू ट्रस्ट योर डॉक्टर एंड हर डिसीजंस. डोंट इंटरफियर कि मुझे नॉर्मल ही चाहिए, मुझे यही चाहिए. द नॉर्मल डिलीवरी इज नॉट अ मार्टरडम. इफ इट इज हैपनिंग नॉर्मली, कोई बेवकूफ तो नहीं है आपकी डॉक्टर की वो आपका सिजेरियन कर देगी. उसको भी तो सर्जरी करना है, बाद में स्टिचेस हील करवाने हैं, कुछ भी गड़बड़ होती है शी इज आंसरेबल. एंड सर्जरी में आपको एनेस्थीसिया का रिस्क है, आपको सर्जरी इट्स कटिंग ह्यूमन बॉडी, एनीथिंग कैन गो रॉन्ग एनी टाइम. सो यूजुअली इन फर्स्ट सिजेरियंस नथिंग गोज रॉन्ग यूजुअली, बट फॉर अ सेकंड और अ थर्ड सिजेरियन थिंग्स कैन बी डिफरेंट. बिकॉज दे कैन बी एडिशन, आप खोला वो सब चिपका हुआ है अंदर से, एडिशंस बने हुए हैं, ब्लैडर खुल गया, बावल खुल गई. So many complications can happen which people don't talk about when they only compare a first cesarean versus a normal delivery, which is comparable. Because mostly people will say मेरी vagina lose हो जाएगी after उसके बाद relations में I will not feel the friction, so I think cesarean is better. So so many times people don't want to go for normal delivery से मुझे pains ही नहीं लेने हैं, मुझे करना, मुझे एक डेट दे दो, अब मैं पंडित से पूछ के डेट लेती हूँ, आपको बताती हूँ, आप मेरा cesarean कर दो. So we are seeing lot of couples and well we say माँ की मर्जी के बगैर हम normal delivery नहीं कर सकते हैं, क्योंकि वो नहीं करेगी तो कुछ नहीं करेगी, तो she will say what are you, how are you going to take out the baby?
Right.
So it's the mindset. But having said that, a normal delivery any day is better.
अच्छा, benefit तो है.
Benefit तो है.
Okay.
If you are worried about the vaginal looseness and the stitches, please start doing your Kegels exercises. Please take help in that sector wherein you can get back to normal sooner.
Sure. एक और बड़ा interesting question which somebody asked me to ask you. India में especially जब बच्चा पैदा होता है, one of the things that is done in a short while after the childbirth is making a future prediction through a पंडित जी, right? तो उसके लिए एक जन्मपत्री बनती है, जिसमें पंडित जी बताते हैं कि इसका क्या होगा अब, whatever. To make that जन्मपत्री, you need two things: the date of birth and the time of birth. The only person who knows the time of birth is a doctor who has done the delivery. The mother is in a unconscious or semi-conscious state, so she doesn't know exactly the time. And a lot of people have, I've been talking to because of this podcast, and a lot of people have been asking, how accurate is that time of delivery captured by the doctor?
Look,
because the doctor is busy. You are taking care of a life.
Yes.
अब आप जैसे उसको निकाला, आप घड़ी देख रहे हो, नहीं देख रहे हो, मतलब I don't know, or maybe there is somebody standing there who's noting down the time.
Yes. See, in a place like Delhi where I am working in a corporate hospital, so we have a team of people. So pediatricians usually, when the baby is delivered, we are waiting for 1 minute for cord blood to pass on to the baby. So first thing they do is look at the watch.
Oh, they do?
They do. The only problem is sometimes that watch is not accurate. So, it happened recently that watch was like 5 minutes behind and there was a confusion ke time kya hua. So, but for now, after that episode, we've decided anytime we enter, we time out एक चीज होती है जिसमें हम करते हैं इतना time बजा है. So everybody will say, okay, इतना time बजा है. So if there is any discrepancy in anybody's watches, they will bring it out कि कौन सी घड़ी ठीक है. So, but we do note.
Because the Pandits finally say that I want the exact time.
No, we do note.
And sometimes
pediatricians will definitely
the time
note.
is 7:24 a.m. And people are wondering, is 7:24 ही था या 7:20 था या?
नहीं, इतना नहीं होता. Few seconds here and there, no.
अच्छा.
Pediatricians they will attend all the deliveries and they are the first one. So when the baby has been delivered through the vaginal route or through cesarean, there is 1 minute's gap when we allow still the blood to flow into where the umbilical cord has not yet been cut and the baby is in our custody.
Right.
So we are busy with the mother and the baby, but pediatricians will look at the watch.
Right. Wow. So tell me, you've been doing this for how many years?
So I joined medicine in 88. So ever since I was in Lady Hardinge Medical College and that was only a Janana hospital. So right from second year onwards, we were told that our delivery is low.
So 1988 means about
35.
12 and 35-ish years. So in 35 years, and if I was a gynecologist, I would do this. But do you know how many deliveries have you done? How many babies have you brought out?
Because, when you are in government hospital, then you don't care. It's like, it's a mania. I still joke with my parents that when my firstborn was about to be delivered, that night, when I was supposed to go on my maternity.
Your child?
My child, yeah. My son, he's 29 now. So, the same night, I was in charge of the labor room. I made the census. There were 40 deliveries we had done in the night. So I have made the census, handed over that, and now I'm going and,
For your delivery?
So I reached home at 11. Normally my shift would end at 9. So by 9:30 I would reach home. But that day I was late. 11:30 I reached and evening my son was born. So
Oh my God.
So I joke with everybody that, well.
So this is not, and this is just a fun question. This is not something that gynecologists or people producing babies are normally tracking. कि अब मेरे 3,000 हो गए, अब मेरे 10,000 हो गए.
No, you can only be.
Beyond the stage, it's so many you've done that now you are like.
Yeah.
So do you think you can do this in your sleep? Like you've done so
No.
many, like 35
yeah, but
years.
still every case is different. Every case
fair
still
enough.
gives me panic, still gives me,
Fair
you know, we are on high alert for every small thing, everything which is like,
Fair enough.
yeah.
So is there a lot of demand for you, like
There
gynecologist
is
with your
demand for
experience?
any experienced doctor, I feel. सफेद बालों की कीमत होती है क्या, you know.
Right.
Yeah, so.
Are gynecologists usually women?
In Delhi, yes, but maybe in Bombay and other places, no. They are mostly men.
Okay. Oh, mostly men.
Yes. Delhi is a very conservative society. So most of the men gynecologists who have kind of graduated from other colleges, say from Bombay or from South, and they come to Delhi and they feel women are not comfortable with them. So mostly they will say, okay, I'm a laparoscopic surgeon. Then they resort to the surgery part of it. That, okay, I will do only this instead of delivering babies.
Interesting.
Yeah.
Interesting. Okay, so with all this information that you've shared, I'm sure people will learn. I have learned. Not much use for me now, but for the audience, it'll be a lot of use, I'm sure.
Yes.
Your last words of advice for people who are either planning a child, planning to conceive, or during pregnancy, right? So for those two sets of target audiences, any broad advice that they should follow or they should think about when they are planning a child, ki chalo, let's have a child now, let's get ready, or when they're already pregnant?
Well, we've already discussed part of the medical advice, but I always tell my couples that, look, invest in your health. ये packaged foods, cokes and all that stuff, refrain. You know, ये किसी का भला नहीं
सबका भी
करती
नुकसान है.
Yes, Coke has very high caffeine, so one should not be consuming it. And also, it's got nothing beneficial to you. It's only going to up your heart rate and it's only going to elevate your blood sugars. So I'd say, you know, just invest in your health and take your health seriously. Visit a doctor, follow the advice, do whatever is needed. Don't say, उसने तो मुझे डरा दिया, अब तो मैं दूसरे के अरे भाई कुछ बात होगी डरने की, तब तो डॉक्टरों का तो काम ही होता है डराने का. ये कोई मतलब this is no logic. So be sensible. So, and look at your, without, वो कहते हैं ना, परम सुख निरोगी काया. So your body is good, you are the happiest person. You have a problem,
right.
It's not good. So since pregnancy is considered kind of a healthy, you know, thing, so invest in your health, buy good food, take a lot of salads and, you know, avoid your packaged foods, and more than anything, follow your doctor.
Yeah. And all this advice, diet and all this is largely for the woman.
But because the pregnancy is inside her. So the
no,
baby
but before they are getting pregnant,
before they're getting
does
pregnant,
the male
it applies.
sperm get impacted by
yes.
diet and all that?
More than, yes.
It
diet
does. Okay.
and smoking and alcohol, everything.
Achha.
So, and of course, when you're drinking, probably you're sleeping late. When you're smoking, you're probably sleeping late. So your sperm quality comes down, your cortisol goes up. Yes, definitely. And your performance goes down. So you will take longer to conceive. You know, we have a thing called a DNA fragmentation index in sperms that shows how much the breakage of the sperm is. That goes up. That causes recurrent pregnancy losses. So of course.
Achha, one last question. Like, मेरे को दिमाग में याद आया. My grandmother used to say, so we had a domestic help who used to come and sweep and mop and whatever. And there was a time when she was expecting.
Okay.
And I was a little boy, and you know, I would ask my parents and my grandmom that shouldn't she take leave now? Like when other women around are pregnant, they get leave from office or wherever they're working. Shouldn't she get leave? And for whatever reason, my grandmom said that in their society, in the poorer society, of course, they can't afford leave. But more importantly, it doesn't impact them because they're doing so much physical work. Their bodies become very flexible, and when they're having a delivery, they have a very easy delivery.
Yeah.
And she said, you know, you will just see one day she will go home and next day she'll be back and the stomach will not be there because she's delivered in the night. And till date, I couldn't figure out if what she was saying was just, you know, her perception or it is a reality.
No, it is a reality.
Oh, yeah?
Because now we say, we ask our women, आप पैरों पे बैठो. इसी पहले क्या इंडियन टॉयलेट होता था तो 10 दफा औरत ऐसे ही बैठती थी दिन में पैरों पे. You know, that gravity pulls the baby down. So when you're mopping and sweeping, and if you would notice, probably you're talking about an era when, Marys भी होती थी ना, वो बैठ के पैरों पे, they used to walk and they used to broom like that.
Correct.
आजकल नहीं है, खड़े होके सब कुछ कर रहे हैं,
Right.
वैसा नहीं होता था. वो खड़े होके पोछा लगाना is not useful. So you sit down, walk. Duck walk is extreme. 90% of girls in Delhi would not be able to do duck walk. The thighs are big, they've never exercised, they can't even sit down. पहले लोग खाने बैठ के चौकड़ी लगा के खाते थे. अब आप चौकड़ी नहीं लगा सकते, आप बैठ नहीं सकते, बैठ गए तो उठ नहीं सकते.
Right.
So then what are you expecting normal delivery? Because pelvic muscles have never. So yes, people who are exercising like that or who are in that profession, they will have an easy delivery.
So my grandmom was right.
Yes. Old is gold.
Thank you so much, Dr. Seema Sharma. This has been such a valuable conversation.
Thank you. Pleasure's all
and
mine.
I'm absolutely sure people would have learned a lot. And my only worry and word of caution is a lot of people will try and reach out to you because, again, what I've heard is that people want to go to the gynecologist or the doctor, the hospital, which has credibility, which is known, which is respectful. And clearly, with 35 years experience, you've done thousands and thousands of deliveries. So I'm sorry if too many people start reaching out. But thank you so much. It was very, very useful.
Yeah.
And to be honest, fun to speak with you.
Yeah, same here. Thank you so much.
Thank you.